What am I saying again?
We're here with KB, who's 18. She's going to describe what had happened to her. She's now completing vision therapy for the type of problem that she has. Take it away.
Well, I mean, I guess in the beginning I just couldn't read. Well, I mean, I know how to read, but I just couldn't do it that well because of all the eye issues that I had. Like my right eye would twitch, but I grew really frustrated with that. So now I can actually read a lot better, and I don't have bad headaches. It was actually, what we did in vision therapy was actually kind of fun on occasion. Like all those games that we had to do, like that helped my eyes. It was actually pretty fun.
What caused the problem to begin with?
I was in an auto accident. I think it was like, 2 years ago?
Mm-hmm.
So that initially caused all of it to happen, and it just got worse, and we didn't really know how to fix it in the beginning, and then we came here and fixed it all.
Can you describe the other therapies that you had before coming to our office and how long it was between the accident and when you came to our office?
So I started, physical therapy a couple months or weeks after, months after the auto accident, and after a while, like pretty well into the summer, she was like, we can't do anything for your eye, so she referred us to some other people, and that's when I started coming here and fixing all the eye issues that I had.
You had mentioned before we went on tape, can you describe how severe and how frequent your headaches were then and what you're noticing now?
My headaches were like every day, pretty bad, to the point where I would just sleep all the time because that was all I could do to just like relieve the pain. And now they're not bad. I get them like once or twice a week, and the pain is nowhere near as bad as it was, so I don't have to sleep them off.
Before you'd mentioned that on a scale of 1 to 10, 10 being the worst, before we began therapy, they were what?
Like a 9.5.
And now they're a
2 or a 3.
And before they occurred how often?
Every day.
And now they occur how often?
Now they're once or twice a week.
Was it worth the effort that you had to make in order to help you solve your problem?
Yeah, it was definitely worth it, because now I can do everything that I did before the accident, but a little faster than I had. So.
Do you feel now you're visually ready to begin college in a couple months?
Yeah, definitely. I'm looking forward to it now because I can actually keep up with other people in my classes.
Wonderful. Now let's turn to Mom. Thank you so much for sharing that. Let's turn to Mom. And Mom's going to share some of the experience that she had. You take it away.
After the accident, it was really frustrating. Young KB here was having a lot of difficulty. She wasn't able to participate in class. She couldn't read, look at the board, take tests, so she basically listened. She missed a whole semester of school. Although she was there physically, she missed academically. We went through physical therapy for balance issues from the concussion. She went through a great deal of therapy with Shore Neuropsychology in dealing with issues related to the concussion. They did a lot of testing, a lot of games to determine her reading. There were just a lot of issues based on her vision, which is what we finally found out. After testing was done, they discovered the right eye not tracking properly, which made it very difficult for her to function because one eye wasn't working right. And they did try to address this during physical therapy, but she said, we really need a specialist. It took a while to find somebody, and fortunately we found Dr. Roth. And after 8-9 months now, she has a new kid. She's improved tremendously. So I can't say enough. It's a big difference.
Can you share with us what you had observed in terms of where she was holding reading material and how she was positioning her body, and at the start and where it is now.
I wasn't really aware until she was tested here, that she was holding reading material very close to her face and that her head was tilted. She was reading at an angle, like she was favoring one eye. I think she was basically trying to read with one eye. And now she's holding reading material at a normal distance. She's holding her head straight, and she's just so much more confident in her abilities.
And that's wonderful because it's rather than being at a one eye type of a problem, it's how she's able to use her two eyes together as a team, both for far away and up close. And she's able to do that just beautifully now. She has really good facility, which means the ease of being able to focus and defocus, the ability to point her eyes in and bring them out. That's called convergence and divergence. She just did a really wonderful job, and we have to commend you for doing the home part of therapy, because that's really important. Thank you so much for sharing that, and thank you so much for letting me help you.
Thank you.